outside Washington, many conservatives are trying to spread as much misinformation as possible. The billionaire Koch brothers have supported groups that have spent millions attacking Obamacare in political races this year. That includes this ad, which features a Michigan woman with cancer who says she can't afford her treatment.
My insurance was canceled because of Obamacare. Now the out-of-pocket costs are so high, it's unaffordable. Congressman Peters, your decision to vote for Obamacare jeopardized my health.
Of course, we all fear for the woman's plight. We all have feelings about that. But the Detroit News reports the facts don't support that ad. The woman will save at least $1,200 a year under her new plan. But she says the idea that her plan is cheaper, quote, can't be true. And, quote, I personally do not believe that. Now, it makes sense that she doesn't believe it, because right-wingers have spread false stories about this law for years and fill the airwaves with nonsense like this.
The government's making the decision who lives and dies. That's what Obamacare is.
When it comes time to schedule your grandmother's cancer surgery, what's going to happen then?
There's new evidence to suggest the so-called Obamacare death panels are in fact alive and well.
It allows the federal government to have all of your medical records. They'll know all of your deepest secrets.
Sounds more like Obamacare to me than Obamacare.
Let's repeal this failure before it literally kills women, kills children, kills senior citizens.
That's literally not going to happen. This law is helping real people. Just today, the Obama administration announced 4.2 million Americans have enrolled in health care plans. A quarter of them are young adults. But the right won't talk about that. Instead, they'll say anything to scare people away from the law, even if it means convincing sick people that they're worse off. Joining me now are Congresswoman Karen Bass, Democrat of California, and Michelle Cottle of the Daily Beast. Thank you both for being here.
Thanks for having us.
Now, I should note we reached out to Koch Industries about that ad, and their spokesman said the Koch brothers were unavailable for comment. Congresswoman, they lost in Congress, in the courts, and the election. Now it seems their tactic is to lie about health care. I mean, do you see it that way?
Oh, absolutely. And you know what? I think this is really a tragedy, because a few years from now, we're going to reflect back on this. And the fact that they spent almost $500 million in the last election cycle to do misinformation around this law is really sad. You know, in California, the Republicans even went so far as to set up a fake website, because, you know, we don't have this issue in California. We have covered California. We weren't a part of the national website. So to see them doing this, it's actually going to result in people losing their lives, because people won't realize that there is actually health care that could protect them.
You know, Michelle, the debunked ad that was put out by a group called Americans for Prosperity. Now, they've spent $30 million on states with competitive Senate races like Michigan, Louisiana, and North Carolina. And Right Wing Watch found audio of the Koch Industries spokesman talking about the Americans for Prosperity, or AFP, last week. Listen to this.
Make no mistake, Charles Koch and David Koch are very simpatico with everything that AFP does, and as well as any one of a number of organizations that they support and try to help flourish.
They're very simpatico. I mean, what does that say about this latest ad?
Well, look, this latest ad is part of a much bigger kind of effort they're making to get into places like North Carolina and help out in races where they think they can turn the tide. And the Democratic Party has finally started responding. You know, they've got this Addicted to Coke campaign. They want to make it very clear to voters in these states that a national group is coming in and trying to influence local elections. You know, how this pans out, we don't know yet. But, you know, at least the Democratic Party is trying to make clear kind of what's happening here with outside groups.
Now, Congresswoman, you know, the Democrats have been more aggressive, and people like me are glad about that, about going after the Koch brothers and dealing with their political support. But here's what GOP Congresswoman Michelle Bachmann says about that.
I just thank God that there's a billionaire or two on our side. All the billionaires seem to be on the radical left, so I'm glad that we've got a couple on ours. I hope we get a few more that are willing to come out, but realize also this is an intimidation movement. I'm sure that the donors on our side don't like to have their names vilified.
Nope.
And that's, just remember, that's really what this is about. Intimidating people from giving money to our cause. That's it.
So first of all, she thinks they're being vilified. And second of all, they need more billionaires, she says.
Well, you know, I mean, I think that that's just completely false, because if you look at the Koch brothers, and a lot of times the comparison is made with labor, and there is no way in the world you can compare two billionaire brothers with the several million members who are in labor unions. And if you compare the dollars that are spent, the Koch brothers spend 3 to 4 times as much money trying to influence elections. But I think what's really important, it's one thing to spend money to influence elections, but they're spending money lying to people about their health care, which prevents people from being covered. That is a tragedy, and frankly, I wonder whether or not it should be a crime.
You know, Michelle, the right doesn't mention the people that are benefiting from the health care law. I mean, let's listen to some of their stories.
Russell Fuller worked at a plant for 40 years, and once he retired, he didn't have insurance. And as a diabetic, he says he desperately needed it.
And the affordable insurance saved me, saved my life, because the fact of I couldn't afford to pay $800 a month.
No one has been harder to reach than the 20-somethings, like FIU law student Alan Zillinger. He was hit by a car while riding his bike in December. He signed up in the days following, no longer willing to take chances.
$40 a month, and that's less than almost every bill I have.
Pereira has been without health insurance for 5 years. With the help of a translator and a health care marketplace navigator, she found and purchased coverage.
Now I'm feeling I'm protected.
These people don't quite fit the GOP narrative, Michelle, I suppose.
They don't fit the narrative, but they are exactly what opponents of the bill have been concerned about. You know, when Senator Ted Cruz would talk about how people, once this went into effect, people would get addicted to it and they would get hooked on it. And the more people that get signed up, the harder it is to do anything to roll it back. And this is why there was such a push before the implementation to kill it. Because once a lot of people get signed up and start benefiting from it, it becomes that much harder to do anything about it.
But here's where the insensitivity comes in, Congresswoman. Here's what bothers me. We understand political parties. We understand partisan feelings. We understand different feelings in terms of ideologues. But shouldn't all of us in the public arena put a separation between when we really want to see healthy people do better and when we want to score political points? I mean, at what point do we really stop being what we claim we're out here for? We can disagree on how to better serve people, but when serving people doesn't matter anymore, isn't that time for us to leave the public arena altogether?
Oh, absolutely. I mean, can you imagine what it would have been like if after this law had passed, the Republicans said, okay, it's the law, now let's all join together to make sure that it works right? Because that's what happened when the Democrats opposed, you know, what was done during the Bush administration years. Everybody came together and they figured out how to make it work. You know, as you mentioned at the top of the program, I'm getting ready to take my 51st vote. It's like this ritual. Every couple of months, we all walk down to the floor, and I vote, of course, against the repeal, and my Republican colleagues vote to repeal it. If all of that effort and all of that money had been put into making the system work, can you imagine what that would mean? That's the point. Well, we'll be watching for the 51st time. Congresswoman Karen Bass and Michelle Carter, thank you both for your time this evening.